through the terminology in the nasal breathing protocol here. So the terminology, first one, we have breathing position. So basically what we're focusing on is aligning our pelvis, spine, and ribcage so we're nice and upright and have that maximum capacity for ventilation instead of being curled over. That's going to limit us. So nice, straight, upright posture so that we can get a nice, good, deep breath. So options here would be something like a full lotus. Right now I'm crossed over just with a little block under my hips. Whatever you need to get in an upright position where your body's not fighting to hold that. You can always be sitting in a chair, something like that as well, or legs tucked underneath you so you're in a nice high position. So that's step one, is getting in a good breathing position. Next we have the breath wave. So this is basically just making sure that we're not breathing up all in our chest, but we are filling our lower diaphragm first, our ribs, and then our chest last. And we're doing this in a 360-degree like circle versus just out through our belly or up in our chest, but making sure we're getting out and pushing back through the back and out through the side. So that's the breath wave, is making sure we're starting at the bottom and filling up versus starting at the top and kind of starting to fill down. Next to here, we have the apnea breathing and the cadence breathing, and these are just breathing rhythms or protocols that we're going to use. So it's going to be inhale, hold, exhale, hold are going to be the 4 numbers you see, and that's just going to be explaining the rhythm. The Kapalabhati breath is going to be, I'll demo it here, but it's going to be a diaphragmatic breath where we're really learning how to use the diaphragm. It's going to help clear out our sinuses as well. So it's going to be really quick little shots within our lower belly. So we're learning how to use that lower belly portion. So what it's going to look like is this, where we're like almost trying to force anything that's in our nose out. And then it's a little lower abdomen, it's just kind of a little shot of with that inhale, exhale. And then the next, we're going to get the bellow breath. So that's going to look similar, but it's going to be a little bit higher up. So we're not going lower abdomen, we're in a little bit higher up here. So that's going to look like this. Next, we're going to go over the nostril pulling and facial massage. So when we do this, number one thing we want to be cognizant of is that we're gentle. Our nose is a delicate feature. So just, we're going to be plugging one side typically while lightly pulling on the other. As you can see that, I'm just pulling very gently, just grabbing the nostril and just giving it that little bit that it needs to help it open up, pulling in different directions, opening that up, and then typically we're plugging that other one while breathing through one nostril at a time. As far as the face massage, what we can do, it's just going to be slight massage, kind of right in here where you see that crease meet your nose, just little circles in there, spending time doing that, and then also getting little sweeping motions coming out. This is all very gentle. As long as we see that we're making the skin move a little bit, that's all we need. We're not really pushing into there. This is about getting that lymphatic system moving and draining the sinuses out, so that's a very gentle touch as opposed to a deeper one. So that's going to be those main ones. You also have a little sinus if you follow your eye down to where that bone is and you're just before you fall off the bone. That's a really good spot to massage too. And then we're going to do light kind of pulling motions away as well. And this one's going to be a little more heavy, and we're trying to move the skin a little bit more than when we're just doing those light sweeps. And then what we also have is the neck release. So it's a couple down here and you'll see it. And so we're working through our SCM, which is that one that if you reach through here and grab, you're going to see it kind of pop out at you. And then your scalenes are smaller along the side. So you're going to find the back of that SCM, and you're just going to press into there and lightly, just like a scrubbing motion, massaging it. And then same thing down the length of that SCM is just coming down and across, just a light scrub. You can get your hand onto there and just little figure eights or circles. And again, this is trying to just soften up those muscles, the fascia, and get that lymphatic system moving. And you can even just sweep that whole area, basically just getting touch in there to help desensitize the nerves and help with the lymphatic system. Next one is going to be the lion's pose. So I'm going to quickly demo that for you guys, what it looks like. This is basically it. So what we're getting is a good like stretch of all those tissues that don't really get to do that. Like how often do you get your tongue out that far? Looks silly, but once you do it a couple times, you'll feel that like the fascia and the muscles, the restraint that they've been in from not getting into those positions often, and that's going to help a lot with that. Next, we have the humming. So what I want you to do when you're doing this is try slightly different tones of this hum and find what feels best for you, and your body's going to kind of tell you what's best. So this hum is super simple, you guys. This is a you can see I'm playing with it a little bit there. We just covered the neck release. The next is the snarling inhale. So that's what looks like this. And it's really just getting the nostrils to open up a little bit more and exaggerating it. So again, that's the Ujjayi breath is going to basically think about, we want to be closing the glottis, which is at the back of your throat. So it's kind of like you're trying to pinch that off back there. And what that's going to end up sounding like is kind of like you're making a bit of like an H sound as you breathe. You're going to do this on the inhale and exhale, feeling the back of the throat kind of closing off a little bit like you're trying to squeeze something there. So it's going to be like, and you're going to feel it kind of back where your tonsils are at the very back of your throat. You'll come over the top of the arch of the roof of the mouth, and just behind that is where we're looking to kind of squeeze that off a little bit. And then the last one, the the headstand push-up. I'm going to shoot that in a separate video just because I need to be moving around a little bit, but I will link that below as well for you guys. And there's a couple modifications there. And just remember with the headstand that we're not aiming to have the perfect headstand. We're really just aiming to get inverted for the effect that it's going to have on our blood pressure and our breathing. And that's what we're using it for, as a tool for that. So just trying to get the body inverted is the goal there.